Scales and the associated diseases. So firstly, we are looking at the colorate scales. The colorate scales, it is defined as a fine. It is peripherally attached, and they are centrally detached scales, and they are present at the edge of the inflammatory lesion. And it is seen in terms of the pityriasis rosea. Now we are looking at a fish-like scales. So the fish-like scales, these are nothing but they are seen in terms of the ichthyosis vulgaris. So they are a large and polygonal. So ichthyos is nothing but fish, and they are large as well as they are polygonal. Next, what we are seeing is the silvery scales. The silvery scales, what we see, they are a characteristic of the process involving the parakeratosis and especially the psoriasis. Next, there is a silvery color is due to the reflection of light. And this is at several air keratin interference. Several air and the keratin interfaces. Next, what we are looking at is mica-like scales. The mica-like scales. So this mica-like scales, they are seen in case of the pityriasis. They are seen in terms of the pityriasis. The mica-like scales, pityriasis lichenoids. So these lesions are nothing but it is polymorphic, and this is with some showing hemorrhagic crusting, as well as they have the adherent scales. Next, we are looking at the yellow greasy scales. The yellow as well as the greasy scales, they are indicative of the seborrheic dermatitis. Then there is nothing but a leaf-like scales. They are suggestive of the pemphigus foliaceus. Then what we see is a powdery, briny or fine scales. They are suggestive of the pityriasis versicolor.